Buenos días a todas y a todos y
Good
bienvenidos
morning,
a la
everyone,
sesión
and
de
welcome to
prensa de la
this
Organización
press
Panamericana de la
conference of
Salud.
the Pan American
Soy
Health
Ashley Baldwin
Organization.
del
I am
Departamento de
Ashley Baldwin from
Comunicaciones
the
aquí en la
Department of
OPS.
Communications here at PAHO.
Hoy
And
abordaremos la
today, we
situación de
will
la
be
vacunación en
discussing
el
the situation of
contexto de brotes
vaccination
de
within the
sarampión
context of
y la
the
semana de vacunación
outbreaks of
latinoamericana.
measles and
Nos
the
acompañan
vaccination week in the
doctor
Americas. We
Jarbas
have
Barbosa,
Dr.
director
Jarbas
de la
Barbosa,
OPS,
director of PAHO,
doctor Daniel
Dr.
Salas,
Daniel
gerente
Salas,
ejecutivo del
executive
programa especial
manager
de
of the special
inmunización
program
en
of
ciudades de la OPS,
immunization of the
Santiago
PAHO,
Cornejo, jefe de
Santiago
los fondos
Cornejo,
rotatorios
head of
regionales
the
de la OPS.
regional revolving funds of
Durante la
PAHO.
sesión, los
And during
periodistas
this
pueden
session,
enviar sus
journalists
preguntas a través de la
may
función
send their
de
questions
QA
through the
o levantando la
Q&A
mano para hacer preguntas en
function
vivo.
or by raising their hands
Asimismo,
to ask
contamos con
questions live.
traducción
We also have
simultánea
simultaneous
en español,
interpretation in English,
portugués y francés.
Spanish, Portuguese, and
Ahora le
French.
cedo la
And
palabra al
now
doctor
I will
Barbosa
give
para
the
sus
floor
palabras.
to Dr. Barbosa for his opening remarks. Thank you.
Gracias,
Thank
Ashley.
you. Thank you very
Muy
much,
buenos días
Ashley.
a
Good
todas y
morning,
todos.
everyone.
Es muy importante tener esta
It is
sesión
important
hoy
to have this
para
session
celebrar
today to
las semanas
celebrate
de vacunación de la salud.
the vaccination
La
week
región
in
de
the
las Américas se
Americas.
ha
The
posicionado
region of
como
the
un
Americas
líder
has
mundial de
positioned itself
inmunización.
as a world
Somos
leader
la
in
primera
immunization. We are
región
the
en haber
first region
eliminado la
to
polio
have
durante
eliminated
los dos
polio,
últimos
rubella, and
40 años. Y
congenital
somos
rubella
la única
syndrome. And
región
we
que
are
ha
the only
recuperado
region
y
that has
mejorado sus
recovered and
coberturas de
improved
vacunación
its
a
vaccination
niveles
coverage
previos a la
to
pandemia.
pre pandemic levels.
Esos logros han tenido
These
impacto
achievements
profundo en
have
las
had a
vidas.
profound impact on
Desde
people's lives. Between
1974, que se
1974
implementó
and
la vacunación infantil en
2024,
las
child
Américas,
vaccination in
ha
the
evitado
Americas, or
aproximadamente
infant
15
vaccination in
millones
the
de
Americas,
muertes
has
en
prevented
niños menores de
approximately
5 años,
15 million
más de
deaths in children under
1.100
5 years of
millones de
age, and
casos
more
de
than
discapacidad
1.1
y
billion
cerca de
cases of
28 mil
disability, and
más de
about
6 millones de casos de enfermedad.
28.4
Pero aún
cases
quedan
of
brechas
illness.
importantes que debemos
But
cerrar.
there are still
La
important
Semana de
gaps that we
Vacunación de las
must
Américas,
close.
que celebrará los días
Vaccination Week in the
27 de abril
Americas,
al
which will
2 de
be
mayo,
held
desde
from
Canadá hasta
April
Argentina,
25th to May
es una
2nd, from
oportunidad para
Canada to
una
Argentina,
oportunidad
is a
grande para
key
redoblar
opportunity
esfuerzos
to
y cerrar
redouble
estas
efforts
brechas.
and close those
Por
gaps.
primera vez,
For the
el
first
lanzamiento
time
regional
ever,
se
the regional
realizará en
launch
Ottawa,
will take
Canadá,
place in
el
Ottawa,
27 de
Canada,
abril.
on April 27th.
Agradezco al gobierno de
And I want
Canadá
to thank the
por
government of
acoger este
Canada
evento en un
for
momento tan
hosting this event
significativo.
at such a
Desde
significant time.
2002,
Since
esta iniciativa
2002,
fue
this
capaz de
initiative
fabricar
has
más de
allowed to
1.200 millones de
administer
doses, contribuyendo al
1.2 billion
control y
doses to be
eliminación de
applied,
enfermedades
contributing to
como
the
la polio,
control or
sarampión,
elimination
la
of
rubéola,
diseases such
congenital
as
y la
polio,
viruela confirmada.
measles, rubella,
En
and
términos
congenital
generales,
rubella
la
syndrome.
región ha
In
mostrado
general
avances
terms, the region
importantes.
has shown
En
important progress.
2024, la
In
vacuna triple
2024,
integral contra
the
sarampión, rubéola y papiras
MMR vaccine
alcanzó el
against measles, rubella, and mumps
89% en
reached
su primera dosis y el
89% in its
79%
first
en la
dose and
segunda.
79%
La
in the
tercera
second dose.
dosis de la
The
vacuna
third
de
dose
Pfizer
of
contra
DPT
difteria,
vaccine, which is
pertussis y
against
tétanos,
diphtheria,
llegó al
pertussis, and
87%.
tetanus, reached
La neumococa
87%.
neumocócica conjugada
Pneumococcal
llegó al
conjugate vaccine
85% en la
reached
tercera dosis.
85%
Y
in
la
its third
vacunación
dose,
contra la
and
hepatitis B al
vaccination
nacer
against
aumentó al
hepatitis
78%.
B at birth
Las
increased
Américas
to
también lideran en
78%.
vacunación
The
contra el
Americas
virus del
also
papiloma humano, el
lead in
VIH.
vaccination
En
against the human
septiembre se acerca la
papillomavirus with
cobertura de niñas
76%
menores de
coverage in
15
girls
años
under
que han
15
recibido al
who
menos una
have
dosis,
received at least one dose,
aún por debajo de la
although
meta
still
que es el
below the
90%.
target, which is
Esos
90%.
avances son alentadores,
These
pero
advances are
insuficientes.
encouraging, but
Más de
still
1,4
insufficient.
millones de
More
niños
than
menores han recibido
1.4
una
million
sola dosis
children
de la
did
vacuna
not
contra la
receive a single
difteria, el
dose of
tétanos y la
the
tosferina este
diphtheria,
año
tetanus, and
2024.
whooping cough
Esos
vaccine in
niños no son cifras,
2024.
son
These
vidas, familias
children
y
are
comunidades
not numbers.
enteras en
They
riesgo.
are lives, families,
Una
and
de
entire
nuestras
communities at
tareas
risk.
más
One of
urgentes en
our
la
most
región
urgent
es
tasks in
apoyar
the
las
region is to
familias a
support
identificar a
countries
estos niños
in
y
identifying these
adaptar sus
children and
estrategias para
adapting
garantizar
their
que
strategies
puedan
to
acceder a
ensure
las
that
vacunas.
they can have
En el
access
marco
to
de la Semana de
vaccines.
Vacunación en las
Within the
Américas,
framework of
los países
Vaccination Week in
están
the Americas,
intensificando
countries
sus
are
esfuerzos.
intensifying their
21
actions.
países planean
21
aplicar
countries are
cerca de
planning to
90 millones de
administer
dosis
about
de
90
vacunas.
million doses
Eso
of
incluye
vaccines.
administrar más de
This
80
includes
millones de
administering
dosis
more
contra
than
la
80
influenza
million
en
doses
preparación
against
para la
influenza
temporada de mayor
in
circulación
preparation for
entre
the
el inicio
season
de julio,
of
que es
greatest
exactamente el mes de julio,
circulation
junio y julio,
especially in the southern hemisphere in June and July, and updating more than 7.2 million children with incomplete schedules or without any vaccination. And now let me refer to measles, and I'm going to switch to English.
In 2016. This status was later lost in 2018, regained in 2024, and lost again in 2025. That same year, 14,767 confirmed cases of measles were reported across 13 countries in the Americas, a nearly 32-fold increase compared to 2024. This trend continues in 2026 and is accelerating. As of April 5, more than 15,300 confirmed cases have already been reported, surpassing the total for all 2025. Mexico, Guatemala, the United States, and Canada account for the majority of cases, with ongoing transmission also reported in Bolivia and other countries. Last year, 32 measles-related deaths were reported, and in the first quarter of 2026, 11 deaths have already been recorded, most of them among populations facing the greatest barriers to accessing health services. Measles hit the hardest where vulnerability is greatest. The reemergence of measles in the Americas is a significant setback, but one that is entirely reversible and demands decisive action. In Canada, the country reached 12 months of continuous transmission from the same chain in October last year, re-established endemic transmission and resulting in the loss of elimination status in both the country and in the region, because if one country loses its certificate, the entire region is considered no more free of measles. But the other countries, they keep their certificate in an individual basis. In other countries, transmission seems to have continued for more than 12 months, raising concerns about the sustainability of measles elimination in those settings. This process is will be thoroughly assessed by the external commission that we have, that is an external body that review the epidemiological data of each country in November when they have their meeting. Elimination is not a trophy to be stored away. It is an achievement that must be defended every day. As long as measles continues to circulate in other regions of the world, countries in the Americas remain at constant risk of reintroduction. In 2025, more than 250,000 measles cases were reported globally, over half of them in Africa, the Western Pacific region, and Europe. Less than 6% occurred in the Americas. In the first 3 months of 2026, however, our region accounted for 21% of all reported cases worldwide. Let me be clear, measles is not a mild disease. It can cause serious and permanent complications, including blindness, pneumonia, and encephalitis. In 2025, approximately 13% of infected individuals in the region required hospitalization, and 93% of them were unvaccinated. We have safe and effective vaccines. The main challenge is not availability, but reaching those who remain unprotected in time. Low-risk perception, misinformation, and barriers to access have all contributed to this situation. When vaccination coverage declines, viruses return. It is that simple. Measles is one of the most contagious diseases known, finding unvaccinated groups and spreading rapidly. A single case can spark an outbreak if we do not achieve coverage above 19% with 2 doses in a very homogeneous way. When it comes to outbreaks, speed matters. The first 27 hours after a case is detected are critical. If we do not act quickly with prepared teams, contact tracing, vaccination, and effective communication, the virus spreads. The Pan American Health Organization, PAHO, is supporting countries by strengthening surveillance, rapid response, and micro-planning for routine immunization and campaigns, while also facilitating equitable access to vaccines through its revolving funds. In 2025 alone, the revolving funds enabling the procurement of 234 million doses of several different vaccines, with savings of nearly 50% when we compare to the individual price that countries could pay for these vaccines. This year, approximately 25 million measles vaccine doses are expected to be delivered across the region. Vaccination is not only an individual decision. It is an act of collective solidarity. Over the past 25 years, measles vaccination has prevented more than 6 million deaths in the Americas. The Americas have stopped the measles before. We can do it again. But it will require sustained political commitment, investment in public health, and decisive action to rebuild trust in vaccines and combat misinformation. I am confident that we can restore the region's measles-free status. We have done it twice before. We can do it a third time. And we can go even further, building a region where no woman dies from cervical cancer, where new vaccines reach every corner, and where vaccine-preventable diseases are a thing of the past and remain so. Thank you very much.
Muchas gracias, doctor. Ya nos ha llegado varias preguntas por email y a través del botón QIA.
Thank you, doctor. We have several questions, and we will have some journalists in the room.
Yet. If you just want to press your mic button.
Hi, good morning. German Abel, asking Vibes and Kids. Two questions from my end. Can you, as we talk about as we have this discussion surrounding measles, and we've been seeing it a slight increase over the last year in the United States, can you give us a sense of where we are within the Caribbean region when we talk about vaccination rate for measles? And is it at the level that PAHU would love to see the entire region at this point? And also, going country specific, can you speak to places like St. Kitts and Nevis in terms of its vaccination rate? I know there has long been some concern, at least coming out of the pandemic, misinformation surrounding vaccination rates and so forth. So where are we in terms of places like St. Kitts and Nevis that are tourism-dependent jurisdictions? Thanks.
Thank you. Do you want to start, Dr. Sala?
Well, thank you for your question. I can say that the Caribbean has been pioneering some of the elimination efforts regarding vaccine preventable diseases. In general, most of the Caribbean countries have maintained good level of coverage for routine immunization. Regarding St. Kitts and Nevis, they have kept coverages above 95% in the last years for measles and rubella, which is quite good. But it's important to remember that it's not just about the data of vaccination for the last year or for the last year. It is a matter of being constant, of keeping good levels through, like 10 years ago, 15 years ago. That's actually what diminishes to the minimum the pockets of unvaccinated. So it's important to remind us all of that. And at the same time, it is important the Caribbean has been able to detect and timely respond to any measles outbreak. And we consider an outbreak when there is just a single case in a country, in a region where you don't have transmission. Just one case is considered an outbreak. And the Caribbean has been very fast to respond, to detect and to respond when you have detected cases.
Gracias, Daniel. Eso también responde a una pregunta.
Thank you, Daniel. This also replies or is a response to another question. I am switching to English again.
Politico that asks, can you expand on why the meeting to review the United States measles elimination status was postponed until November? Was that a request from US health officials? And if so, what was their reasoning? Don't know if Dr. Barbosa wants to start.
Yes, thank you. Thank you for the question. First, the meeting was not postponed. The meeting happens every year on November. So it will happen at the same time that we had the meeting last year. Second, no, the US government has not asked the PAHO to postpone, to delay the meeting in any kind of a condition. So the meeting will review not only the US data, but also the Mexico data and all the other countries that have transmissions of measles. And after this meeting, they will make a recommendation. So these are totally independent review, a thorough assessment that is performed with no kind of political influence from our side, from any member state side. So this is so just to clarify again, the meeting was not postponed. There was in April, this commission received some information from the US, from Mexico, but the meeting will happen in November. And we are not changing the date of the meeting because with the current situation of the transmission of measles, we cannot have a meeting every month because if a country completes the 12-month period in May, in June you have a meeting. If another country completes in June, you have another meeting in July. This is not the way that we are doing. The meeting will happen in November. And let me tell you one thing. The most important thing is not the certificate, is to stop the transmission. So we cannot wait November or any other month. We need to stop the transmission now. We need to work now to stop the transmission. This is our priority. Thank you.
Many thanks, Dr. Barbosa. We're going to go now to a question from Alana Smith from Globe and Mail. I believe she's connected live. Alana, would you like to ask your question? No, if not, I can ask for you. So Alana wants to know, please provide an update on the measles elimination status of Mexico and the US. What efforts are being made to curb measles in these two countries? And how has Canada progressed since losing its status? So there's quite a lot there. I don't know if Dr. Salas quiere empezar.
Yeah, sure. Thank you. Thank you for the question. And definitely the current outbreak that we have been experiencing in the Americas started in Canada, and it spread to the US, to Mexico, and from those countries, and mainly Mexico, to other countries in Latin America. The level of complexity, of course, it varies according to each country, according to the epidemiological context. We know that there is a factor that is decisively, I mean, it's one of the most important things that we can have for a country to not have a constant spread of the virus. And it's actually to have homogeneous vaccination coverage. You may have a 93% with the first dose. You may have a 89% with the second dose for the last years. But if you start to look internally, you're going to find those areas that have been like left behind somehow, that have been accumulating, adding up cases, one year, and then you have suddenly a number of, important number of unvaccinated that is going to be the engine for these outbreaks. In Mexico, the US, and Canada, each authority has been taking many actions to combat and try to control the outbreaks. And it includes, of course, vaccination, not just the initial vaccination, which is the ring vaccination when you detect a case, but also like some additional campaigns and activities. Of course, to strengthen the surveillance systems. In general, it is important that the system can be sensitive enough to detect the cases on a timely basis, at the same time to deploy the rapid response teams so that there is no delay. Those 72 first hours are going to be key to determine if you can control an outbreak on a timely basis. And of course, when you have consolidation of the transmission, you need to study each population, what are the conditions, the background conditions that are promoting the spread of the virus, and of course try to address some of the cultural barriers that you might have. For example, coordination with schools, with the private sector. I mean, it's a matter of how the communities can be engaged to have a more robust response to deal with the outbreaks. And the authorities have been working on that. And of course, we are also supporting each country to try to stop the outbreaks. And I don't know if there was like any other remaining part of that question. I think that was like most of it, yeah.
I think you've answered it. Thank you very much, Dr. Salas. We can see that Helen Bramswell from Stat News has her hand up. So would you like to ask your question, Helen?
Hi, yes. Can you hear me? Can you hear me? Hello?
Okay, we're working on it. We're working on it, Helen. So hold tight. We'll go to another question. Oh, no. We've got it?
Hello?
Oh, okay.
And we can write it in the chat.
Okay.
So, Helen, go ahead.
Oh, go ahead, Helen. Sorry.
Hi, can you hear me now? Can you hear me now? Hello? Hello? Can you hear me now?
Helen, not sure if this helps. This is one of the interpreters. I can hear you, okay? But apparently not out on the floor. Don't really know why.
Okay, please go ahead, Helen. Apologies.
Can you hear me now? I see a nodded head. I will try. I wanted to circle back to the question from Politico about the meeting to assess the elimination status of the United States and Mexico. Dr. Barbosa said that the meeting was not postponed, but I have in my inbox email from PAHO announcing a meeting that was going to take place on April 13th to discuss measles elimination status for Mexico and the United States, and that meeting was indeed not held. So can you please explain how we're supposed to understand that? And Dr. Barbosa said that there was no political pressure from the United States. I'm wondering if there might have been a request from the CDC for extra time because of the complexity of trying to address figuring out how long transmission has been occurring. Thank you.
Many thanks, Helen. Dr. Barbosa, would you like to start?
Yes, no, thank you. Again, the meeting will happen in November, and the committee is an external commission that you have we have some very excellent participants there, people with a very strong technical background. In April, there was an initial discussion about receiving data, reviewing the data, but the formal meeting to review the situation of the elimination will be in November. Yes, the US CDC asked us to provide more data, and it's important because this will probably be another tool or another methodology to address more data, to better understand the dynamic of the transmission. But the US will be reviewed using the same standards and criteria that every other country in the region. There is no privilege to receive better information or less information, because the criteria is already established. and this was used for Canada last year. Canada, the meeting was in November. The period of 12 months is happening in October, so in the meeting in November, the Commission had all the data to make the assessment. In November this year, they will review the US and Mexico. Using the data that are provided, including this new genomic surveillance data that the CDC will provide, the criteria will be the same, and the decision, the recommendation from the committee will be totally technical, based on the information that the countries are providing. Thank you.
Thank you very much, Dr. Barbosa. I believe we have a question from the floor. Yes, you start. Thank you.
Hi, Charlotte Kazit from AFP. Just wanted to follow back on previous questions about the outbreak in North America. Could you kind of like explicit a little bit what are the differences that you've seen, you know, in the dynamics of the outbreak, maybe in Canada, Mexico, and the US? Are there like the same, you know, drivers, like the same factors about the slowing rate of childhood immunization, or are there like other type of challenges maybe related to different populations?
Thank you, Dr. Salas.
Yeah, thank you. And thank you for the question. Actually, for Canada, the situation has been and been basically happening in close-knit communities. It hasn't spread all over to the rest of the population, has been like very, very into that group. And of course, that talks in favor of, or that speaks in favor of, you know, good levels of immunity in general in the population. Unfortunately, I mean, these close-knit communities that are like in the different provinces has maintained mainly this chain of transmission. And these close-knit communities are somehow reluctant to receive vaccination. So, I mean, that's like a very specific case. For the United States, of course, I mean, the pockets of unvaccinated has played a major role, and we know that, I mean, it depends on each state, which is the level of coverage that they might have. And it's important to always try to have the 90%, as I was mentioning, for the 2 doses in a homogeneous way, even internally, because the state, you know, has several counties, and there are some states that are quite big. So it is important to review internally, because that's what has been happening, that there are like some counties that has not optimal levels, and of course that has feed, you know, the continuity of the outbreak. In the case of Mexico, for example, it started like in the border with the US in Chihuahua in 2025, but now it has like, you know, moved to Jalisco, to Chiapas. Ciudad de Mexico has been reporting some cases. But we can say that probably the most important driver in Mexico has been like the farmers and the seasonal like activity where they travel internally. And of course, some of the activities that they might have, that, you know, events that they might have that has spread the virus in different states. But I mean, of course, there are particularities in each country and of course in each state or province.
Thank you very much. Now we're going to go to a question from Jorge from El Sol de México. No sé si quiere preguntar
I
en
don't know
vivo.
whether you'd like to ask your question live.
And if so, which channel?
Hola, ¿qué tal?
Hello,
Buenos días.
good
Soy Jorge
morning.
Salcedo de
My
Abejorro
name
Media.
is Jorge
Discúlpenme, no se
Salcedo.
actualizó
I don't know, I
mi
apologize.
acreditación.
My
Una pregunta muy
name may
rápida
have
sobre
not
si habían
updated, and
detectado la
this is a
presencia
quick
de
question whether you
vacunación
had
falsa o
detected
apócrifa
fake
contra
vaccination cases
contra el tema del sarampión en la
in
región de
connection
México.
with
Apenas salió una
measles
nota
in the region.
sobre
In
esto y queríamos
Mexico,
saber
we
si tenían
had
alguna información sobre esto.
news on
Gracias.
this, and we wanted to know if you had any information on this. Daniel, would you like to address this question, or Dr.
It is
Barbosa?
important always to, I'm sorry, in Spanish. Sí, no, que siempre es importante,
It
obviamente,
is
revisar
always
los datos que hacemos
important
con cada
to
país.
review
Estos
data. We
reportes de
do that
vacunación
with
falsa
every
pueden ocurrir
single
eventualmente.
country, we may have fake reporting right now. We do not have any information that this may be an event that may have an impact on transmission in Mexico, but clearly it is always important two things here for the information systems to be working and for PAHO to be strongly promoting for all of the countries to migrate to having a nominal electronic registry that actually covers all of the country, that allows to detect where the unvaccinated population is, and that strengthens data, and also to have the quality of the information to find those who are unvaccinated. And secondly, communication. It is important for the population to understand that there is shared responsibility. Immunization coverage and updated vaccination is extremely important if we'd like to decrease mortality and also complications due to measles and mortality in other cases. This is important because there could be, of course, manipulation of information, but here we all need to work to have truthful information that actually matches the vaccination status of the communities and the families.
Solo para complementar, el tema
Just to add
de vacuna falsa
on
también, que viene la
fake
pregunta. Mira, la
or
Organización Panamericana de la
vaccination
Salud brinda uma
information,
cooperação técnica a los países
Pan American Health
para que puedan
Organization
tener
has technical
toda la cadena
cooperation so that the
de
countries
control de
may have
calidad de las
all of
vacunas.
the
Primero, la
quality
vacuna que
control for the
ofrecemos por
vaccines.
nuestros
First, the
fondos,
vaccine
el
that
Fondo
we
Rotatório de
offer
la OPS,
through
são
the
vacunas de alta
revolving
calidad,
fund
vacunas
at
de
PAHO
produtores
is a high
pré-qualificados por la
quality
OMS.
vaccine
Segundo,
made
que
by
apoiamos os países para que
pre-qualified
possam desenvolver
manufacturers. And
todo
then
sistema
we
de
also
controle de
support the
calidad,
countries to
quando se
develop a
transporta a
quality
vacuna,
control
quando se almacena
system,
as
how
vacunas,
the
em
vaccine
las
is
centrais, em los
transported,
centros de
shipped,
salud. Há
also
controle
how it is
rigoroso de la
handled at
calidad,
the
se a
health
temperatura está adequada
centers,
durante todo
what
el
the
tiempo,
right
hasta que a
temperature
vacuna
is, and whether the
sea
temperature is
aplicada a
maintained
uma pessoa.
throughout the
Sim, não
process until
temos
it is
registro
administered to an
de
individual.
vacunas
We do
falsas,
not
incluso
have
o
any
MEC tem uma
records
autoridade
of
regulatória COFEPRIS,
counterfeit
que é uma
vaccines,
das autoridades
and
reguladoras
also
maiores
the
de la
Mexico
região. Então,
has
se
one
há
of the best regulatory
algum evento
authorities
que por algum motivo
in
se
the area of
utilizou, seguro
vaccination.
que
So if
isso
for
deve ser
some
muito
reason
localizado
that
e sem nenhum
vaccine
impacto
was
em la
used, it
credibilidade
has
da
to
vacunação
be
em la região.
localized and it has no impact on the credibility of the region. It is also important to mention that ministries are always informing on the vaccination centers, and it is always important to review the information published by the ministries so that the various vaccination centers are known to the population. I thank you. We have several individuals who have raised their hands in the chat. So now we are going to go to Melina Ochoa from Uno TV from Mexico City. But first, I would like to know whether after that, Valentina Schustel from the National Radio of Spain would like to ask her question. So first we go with Melina and then with Valentina if you'd like to ask her question live. Good morning. I don't know if you can hear me. Melina Ochoa. Very well. Melina Ochoa, journalist with Uno TV in Mexico. So thank you for the opportunity to ask you questions. This is also a question on Mexico. This is to know whether you think that the measles outbreak is contained. The authorities have informed that the pace of the transmission in the territory is down. The transmission continues, but not at the pace we saw in early 2026. And if that is the case, whether you agree that this outbreak is contained in Mexico, and also now given the World Cup that will start on June 11th, whether you forecast any increase in the rate of cases in Guadalajara, Jalisco, Monterrey because of the movement of people, and whether you have any idea as to how long this outbreak in Mexico could continue, even though after the 12, if they obtained the 12-month certification without any sort of transmission.
Sí, yo me voy a referir a la primera pregunta.
Let
Muchas
me
gracias por
address the
hacerla.
first question,
Em,
and I thank you for that.
es importante,
It is
la
important
OPS, por ejemplo, toma
to
como
say
parámetro
that
para decir que
PAHO
un brote se cerró, tomar 12
considers that
semanas
an
después del
outbreak has
reporte del último
concluded
caso,
12
porque
weeks
puede ser,
after the
hemos
last
visto que varios
report
países
of a
empiezan a
case,
descender, la curva
because
epidémica
or
empiezan a
because we
descender los
can
casos por
see
varias semanas
a
consecutivas, pero
drop
recordemos
in the
que el
epidemic
sarampión puede tener
curve,
un
but
periodo de
measles
incubación
also
de
has an
hasta 21
incubation
días
period of up
y que a
to
veces los reportes no se dan de una
21
forma
days,
oportuna.
and that the
Entonces, por eso es que
reports are
nosotros,
not timely
tomando diferentes
sometimes.
factores,
So,
damos
by
más tiempo
considering
para
different
verdaderamente
factors,
estar
we allow
tranquilos
for
y
more
seguros
time
de
to
que
have
todos esos
the
factores se
peace
tomaron en
of mind
consideración
that all of the
y que
factors
no
were
hay
taken
algún
into account and that there
enmascaramiento
is
o
no
alguna transmisión silenciosa que podría no
silent
detectarse
transmission
oportunamente.
or some
Y es
sort of
cierto, o sea, México
hidden
este año ha
data.
reportado ya
So,
más
and
casos
it
de lo
is
que
true
reportó
that
el
Mexico
año
has
anterior,
reported more cases
pero,
than
y sí, ha venido
the
disminuyendo en las
ones
últimas semanas, sin
reported
embargo, es
last
importante
year,
tener ese factor de
but they
prudencia
have
y
improved over the
esperar
last couple of
justamente
weeks,
ese
but we need
criterio
to
que
be
manejamos en
cautious and wait for
las
that
Américas.
criterion that we use here in the
Déjame solo
Americas.
complementar, además
Just
do
to
que
add to what Dr.
Daniel
Salas
ha
said,
mencionado, Melina, todos os grandes
Melina,
eventos de massa
all of
são
the
seguro
large
que são
mass
importantes
events
de ter
are likely
uma mirada
to
também do ponto de vista
have
de saúde pública.
are likely
Apesar
to
de
be
que hoje,
considered from the point
com
of view
toda
of
a
public
facilidade de
health.
viagens, temos
And
milhas
now
de pessoas
with
que se
travel,
movimentam por el mundo
we
todos
have
os dias.
thousands, millions of
Durante
individuals who
a
travel
Copa del
all
Mundo,
over the
é
world
importante,
every day.
primeiro que
During the World
México,
Cup,
nós
it is
estamos
important
apoiando a
for
México com base
Mexico,
na
and we are
experiência que
supporting Mexico
temos de
based on the
apoiar
experience that
antes
we have
a
already with
realização de Copa América, de Copa del Mundo,
the
de Olimpíadas na região,
Cup of the
a trabalhar
Americas
com
and
os
also
países
the
que
Olympics.
são
We
sede
are used
para
to
fortalecer
working with
sua vigilância,
countries to
para identificar
strengthen
de
their
maneira muito rápida
surveillance
qualquer
so
caso de
that we can
enfermidade, o mais
quickly
comum
identify
que
any
temos, baseado na
diseases.
experiência
And
dos
the most
últimos
common
20
one
anos
that
da
we have
região,
over the last
são
20
brotes de
years
enfermidades
is
diarreicas, que
outbreaks
pode
of
passar por comida
dia-
sem qualidade nas calles,
diarrhea-based
que alguns
diseases
turistas
because of
comem.
eating
Pode
food
ter
of
alguns brotes de
the
enfermidades
street or
respiratórias.
some
O mais
other
importante é tener essa
of
vigilância
street kiosk, and also there could be
com a capacidade bem ética, com a capacidade de identificar
the
rapidamente qualquer
possibility
caso.
to
Se é um caso
quickly
de sarampião,
identify cases. If we're talking
imediatamente
about
implementar,
measles,
como mencionei,
there
nas
should
primeiras
be, as I
72
mentioned
horas,
before,
todas as ações
for
de
the
contención del
first
caso, de hacer el
72 hours
traceo
to
de los contactos,
to
vacunación,
introduce all the
etc.
containment
E
measures and
estamos
also
haciendo, segundo a
contact
recomendação, que todos
tracing.
que
And
vão a
we're
venir, que
also
vão a
adding the
participar da Copa, que se
recommendation that
puedan
for
vacunar.
everyone to
A
participate
vacunação de sarampión,
in the
como a
cup
maioria
to
de las
please be
vacunas,
vaccinated.
empiezam
In the case of
a tener um
measles, the
efeito de proteção
vaccine
2 semanas
starts
depois que
to
tomam a vacuna.
protect
Então,
2 weeks
não hace
after
muito sentido
the
vacunar-se
vaccine
no
is
dia que
administered.
vá,
So
no
it
período
doesn't
que vá
make any
viajar.
sense to
Se
get
deve tomar a
vaccinated the day
mínimo com duas
before
semanas antes, para se
traveling. It has
já
to be at
sabe
the
que
very
vai
least
venir
2 weeks
para
before.
participar
So if the
da
person
Copa del
knows that
Mundo,
the
tomar a
person will
vacuna
be
lo más
traveling,
pronto possível,
then
porque vai estar
the
mais
person has
protegido
to
para
be
viver.
vaccinated
Se
as
com essa
early as possible
combinação
because the
de uma
protection will be
vigilância
higher.
forte e
And
essa
also
recomendação
this,
que
in
hacemos
connection with
de
strong
vacinação, creio que
surveillance and also the
podemos fazer
follow-up
uma
that
Copa
we
del
have for
Mundo
our
onde os
vaccination, I think
países
that we
se
can have a World
fortaleçam,
Cup
né, com mais
where countries
momento
are
de aprender a
strengthened
manejar eventos de massa que
and
são
they
comuns
learn
em
how
la região. Há
to
carnaval com cientos de miles de
manage large
pessoas em
events such
alguns
as,
países.
if we think of
Há
Carnival, where we
festividades
have thousands
religiosas,
of people
cívicas,
from different
de
countries, or if we
festividade. Ou
think
seja,
of
é uma região
religious
que está
festivities.
acostumada a
So
manejar
this
eventos
is a
de massa
region that is
e na
used
Copa
to
del Mundo vamos
these
apoiar
large
todas essas
events, and
lições
during the
que já
World Cup,
aprendemos
we are
para
going to
fortalecer
apply
a
all of
vigilância e
the
poder
lessons that we
identificar
have
qualquer
already
brote
learned
por
to
qualquer
strengthen
causa de
surveillance and
maneira
also to
imediata.
identify any
Gracias.
outbreak for any reason
Y con respecto a la
immediately.
tercera
Thank
pregunta,
you. And in
¿cuánto
connection to
podría
the
tomar
third
para
question,
que
how long would it
ya no haya
take
más casos? Bueno, eso es muy variable y va a
to
depender
have
justamente
no
de
cases?
cuánto
That
susceptible se va a
depends
encontrar
on the
el
level
virus
of
en
sensitivity
el
of the
resto de las semanas,
virus
de los meses.
throughout the
Puede ser que
weeks,
ya
throughout the
el número de
months.
susceptibles,
It
por
could
ejemplo,
be
se vaya
that the
agotando
number
en
of
cierta
sensitive
comunidad, en
cases
cierta
is exhausted within some
distrito o municipalidad,
communities, districts,
pero
municipalities, but someone travels, that person traveled, and they are faced with another number of vulnerable individuals, and the situation is different. So when Venezuela had a significant outbreak almost 2 years ago, they were able to control the outbreak over 2 years. Brazil took about 3 or 3 years and a half to control the outbreak. But when we see a drop in the curve, that is a good sign, but we cannot hope to have only 3 weeks of no cases. That it could be a false case of trust, in the sense that there are no more cases, because the virus may still be being transmitted. I thank you, Dr. Salas, Dr. Barbosa. I also see that you already addressed the question by Valentina Chusti from the National Radio of Spain, so I am going to move on to a question by the New York Times.
On the fact that the Trump administration's 2027 budget request eliminates funding for the Pan American Health Organization? Dr. Barbosa?
Thank you. Thank you for this question. Of course, this is a challenge for us. Right? We really hope that the U.S. administration can change this decision. We continue to work together with the U.S. Health officials, and it's very important for us, first because the U.S. is a member of this organization. The U.S. was one of the founders members of this organization for the first 45 years. The director of the Pan American Organization was the U.S. Surgeon General of the U.S. So only after that, the countries decided that they should elect the director. We have so very strong ties with the United States, and we are open to all conversations that are possible, showing how relevant it is for the region, but also for the U.S. to be part of the Pan American Health Organization as an active member. I think that two reasons are very relevant. The first one is for the regional, but also the national health security. The Pan American Health Organization, we coordinate a regional surveillance system that last year detected 2 million signals of health problems in the region, because we have a 24/7 system that looks social media, media vehicles, the internet, everything, trying to get words like fever, outbreaks, unknown disease, hemorrhagic fever, epidemic, things like that. Every signal is reviewed by our technical team, and when there is some basis for a concern, we immediately contact the Ministry of Health. We also have received information 24/7 for all the 35 member states of PAHO and the territories that you have in the region. So only last year, we had more than 150 public health emergencies in the region, from hantavirus outbreak, dengue fever outbreaks, measles outbreak, chikungunya and Zika outbreaks. So and all this information is shared with the United States and all the countries in the region in a totally transparent way. So I think that it's very important for the U.S. being a part of this system, because it allows the U.S. health officials to receive information and to be better prepared. The second is that we have also a long-standing tradition to implement the health programs in the region. We have a very strong county presence. We are present in every county and territory in this region. And we are supporting the countries to advance immunization coverage, to reduce maternal mortality, to eliminate diseases like TB, HIV, and malaria, to reduce the preventable deaths related to non-communicable diseases. So the history has shown that when we work together with the U.S. administration through the USAID funds that were part in the past, we received as voluntary contribution from the U.S. We supported several relevant initiatives. With these funds, we achieved the elimination of malaria in several countries in this region, for instance, and several other public health examples. So we are working, we are strengthening the dialogue that you have, because we really hope that this decision can be changed, because this will be very beneficial for the region, for the Western Hemisphere as a whole, but also for the United States of America. Thank you for this question.
Many thanks, Dr. Barbosa. Santiago?
Well, thank you very much. Also, I would like to add that the United States has been one of the hub of innovations in pharmaceuticals. Also, it's very beneficial, this relationship. Through the revolving funds in the last 2 years, we have incentivized technology transfer from the latest innovations in terms of vaccines that are developed in the United States to Argentina. And these technology transfers have allow us to have early access to these innovations, these new technologies, and a benefit for all the region, not only just the US, but also for all the region. So we have these new vaccines, the pneumococcal vaccines and the influenza vaccine. Thank you.
Many thanks, Santiago. We can see that Reuters have their hand raised. Would you like to ask live?
Yes, can you hear me? Thanks. Julie Steenhuisen with Reuters. I just wanted to go back to understanding better the April meeting and why it was postponed. We understand that the CDC is using advanced whole genome sequencing to try to evaluate measles chains of transmission. Is that why the meeting in April was postponed? Was that work not yet completed? And can you tell me how PAHO will use this newer method of establishing transmission chains as you evaluate our measles elimination status? Thank you.
Many thanks, Dr. Salas.
Yeah, and thank you for the question. Important to mention that for assessing the condition of a country, if there is a loss of the status of the transmission of measles, we take into consideration the epidemiological data, and of course, based on laboratory as well, the situation of the vaccination coverage, and the response capacities that countries have in place. Those are like the main factors, but there is no new methodology at this moment. We know that the United States is putting an important effort to strengthen their capacities on whole genome sequencing. They are trying to find eventual patterns of change, of mutation, in the parts of the virus that are not usually subject to tests, which is, quite an important part. It's not the most mutating part of the virus, but they're trying to do this. They're trying to collect or to get samples from Mexico and Canada, and have a bioinformatics pipeline designed to conduct a thorough analysis of these. Of course, this takes time, and we know that they're doing this, but definitely, as the director mentioned before, the decision to keep the annual cycle responds to simplify the process. The RVC receives reports, national reports from 47 different territories and countries. And of course, we have follow-up, meetings, the visits to countries. It's an extensive work for at Honorarium Group. So it is important to keep it as simple as possible, to standardize the process among countries, and at the same time with other RVCs from other regions that keep this annual cycle of assessment.
Let me just complement, because sometimes it's difficult to understand why do you need 12 months of sustained transmission that is epidemiological linked. Because when you have one country, let's think about the US, for example, you can have 12 months of transmission, but you can have an outbreak in Texas that you take from January to April. After that, an outbreak started in New York from May to October, and in Florida from November to December. So when you look at the data, it looks like there was a 12-month transmission, but you need to review the case to see if all these outbreaks are epidemiological linked. And this requires data from not only the number of cases, but we need to go further, and we need to review laboratory data that will show that the cases are linked. Even in the same state, sometimes you can have one outbreak, one traveler comes from a country in Europe or Africa, and it started an outbreak of 6 months. It's controlled. After that, another traveler can come and start another outbreak that will take another 6 months. So for this reason, that it's not as easy as, no, but there is a transmission for, we have reported cases for 12 months, so the business is already done. No, it's not true. We need to be very serious about that and to receive the data, the technical data, the reviewing process that is totally independent, as I mentioned, made by this commission. I want to thank them for their voluntary support to the region of the Americas and to PAHO. And after this review process, that will happen every year in November. Every year in November, not only this year, but every year in November. Thank you.
Many thanks, Dr. Barbosa. We have a question that arrived prior to the conference from Vanessa Antonieta de Contrapunto in Venezuela. Quiere saber si tenemos
She
datos
would
de
like to know
cobertura
whether we
de
have
vacunación
information
en
on
Venezuela
vaccination coverage
y
in
ya Venezuela
Venezuela
puede
and
acceder al fondo rotatorio para las
if
vacunas.
Venezuela can already have
No
access
sé
to
si
the
quiere
revolving
empezar
fund
Daniel y
for
después Santiago.
vaccines. Daniel, would you
Sí,
like to
muchas
start?
gracias por la
Yes,
pregunta.
I thank you
Bueno,
for the
Venezuela
question.
justamente logró la
Venezuela indeed was
verificación
able
de su
to
estado libre de
obtain
sarampión.
re-verification
Hicieron
of
un
their
proceso
measles-free
importante tratando de impulsar
status.
la
They
microplanificación. Eso fue
attempted
hace unos años
to
atrás, pero principalmente se
to
logró
have
porque hicieron una
micro-planning,
revisión
but
por
it
varios
was
años
possible
exhaustiva,
because they
una
were
búsqueda
able
activa de
to
casos
conduct
en el
thorough
país.
search of
Las
cases in
coberturas
the
es
country.
importante que sigan
The
trabajando para
coverages
mejorarlas. Sabemos que el
they
país
need
se
to
está
continue
planteando en
working on
este
the
momento
coverages.
cómo
We know that the
reformular
country is
mucho de
looking
cómo
at
se
how
lleva a
to
cabo el
restating
programa de
and
inmunizaciones y
how to
fortalecer las
do
áreas que
this
necesitan mayor
immunization
fortalecimiento.
program and
Definitivamente,
what
sí, las
areas
coberturas de
do
rutina
need more
necesitan
strengthening, but
elevarse,
routine
pero también es
vaccination
importante
rates
decirle a
need to
todos los
go
medios
up,
de
but it is
comunicación
also
que
important
OPS
to
tiene a disposición
say to all of the media
los
that
países la
PAHO
información que puede ser compartida a
does
través
have
del
information
dashboard de inmunizaciones
available
donde se
that
puede
can be
revisar
shared
los
with the
datos de cobertura a
countries
nivel
through
regional y
the
del país también.
immunization
Gracias.
dashboard, where you can see the information for each
Sí, muchas
country
gracias por
on
la pregunta.
immunization. I
Y
thank you
quisiera
for the question,
complementar
and I would like
que
to add that
Venezuela está
Venezuela
accediendo a las vacunas,
is
compran las vacunas a través de
having
los fondos
access to
rotatorios.
the
Entonces,
vaccine. They are buying the
Venezuela tiene
vaccines
la
through the
posibilidad
revolving
y
fund.
está utilizando
Venezuela
los
does
fondos
have the
rotatorios. Hemos
possibility
enviado todas
to
las vacunas
buy
de
the
rutina,
vaccines
las han
through
adquirido a
the
través de los
fund.
fondos
They have also
rotatorios
sent
como la
the
triple viral
vaccines
que tiene
such as, for
sarampión,
example,
pero también
MMR that also
polio,
includes measles, but
pentavalente,
also
fiebre
polio,
amarilla
the
y también
pentavalent, and
los
also the
fármacos que se
yellow
necesitan
fever
para la vacunación como las jeringas.
vaccines,
Entonces,
as well
Venezuela
as
está
the
accediendo
needles
al
have
fondo
been
rotatorio.
sent. So
Gracias.
Venezuela is having access to the revolving fund.
Muchas gracias,
Thank you.
Daniel y
I thank
Santiago.
you,
We
Daniel.
have
I
another
thank
question from
you,
the room, I
Santiago.
believe. Thank you.
Hi, Nat Lash at ProPublica. Just to circle back on Reuters' question, so the development of this bioinformatics pipeline, does that mean that the U.S. is trying to contest whether it's had a continuous chain of transmission for 12 months?
Yeah, basically, as I mentioned before, we use the epidemiological criteria to link the chain of transmission has been something like, I mean, truly not replaceable at this moment. For example, Canada, they conducted whole genome sequencing last year and for several years. But what the US is trying to do is actually, we analyze usually, as I mentioned, a small part of the virus. When we do the test of the PCR, there are just 450 nucleotides that are analyzed. And the virus in total has almost 15,000 nucleotides. So what the US is trying to do with this whole genome sequencing is trying to find some patterns that could eventually say, for example, this mutation of the virus occurred in a different country, in a different place, to the current outbreak that they're trying to analyze, so that eventually that might be taken into consideration to somehow replace the epidemiological information that is missing. So that's what they're trying to do. This is not something easy. As I mentioned, there's no country that has done this before. And of course, they're trying, putting a lot of effort to try to demonstrate that.
Just to add that if there is any additional criteria, this criteria will be used for every country in the region. So the criteria is exactly the same, from Canada to Argentina, the criteria that the Commission uses is the same. Of course, that countries that have more technical capacity can provide more data that will be part of the analysis, but the criteria is exactly the same for every country.
Go ahead.
So just to clarify, the idea of what a strain is or a particular lineage, that can vary according to the technical capacity of the country, but that criteria would be the same if it's N450 versus WGS?
The region has developed a lot of capacity. You know that before the pandemic, only Canada and the US had the capacity to perform genomic surveillance. Now we have all the countries in the region, 30 countries in the region that have capacity. We coordinate a network of genomic surveillance in the region. So this is maybe another argument why this is so important. But of course, a country can provide the core set of information and can provide additional information for the Commission. This effort that the US CDC is doing is important to not only for the region, but maybe for the entire global surveillance of measles, because the idea that we can use the new technologies, new methodologies will add, I think, that an extra layer of protection to the surveillance.
Many thanks. We have another question from the room. Go ahead.
And maybe if I might add like an additional question to clarify, is the objective to kind of like understand whether the new maybe strength of measles that is circulating could be more resistant to vaccine? Is it like what you have in mind, or is it more to kind of like understand where these new like outbreaks are coming from?
Yeah, no, basically what the US is trying to, work with these whole genome sequencing is trying to find the blanks that may exist between the Southeast outbreak, the initial Southeast outbreak that was closed. I mean, it is closed, and they're having a new one, and the outbreak in Utah and South Carolina. So, I mean, there is not enough information about the epidemiological tracing of contacts that can eventually link that. So they're trying to eventually, this is not something that has been done before, they're trying hard to eventually find some mutations in that other part of the virus that we usually do not analyze, so that they can eventually say, this, for example, mutation eventually happened and is the same level of mutations, the patterns that, it's something difficult, but they can eventually find the different pattern that can eventually show that the outbreaks are linked or not. It's basically that. The virus has not manifested any kind of mutation that can like make us think that is not a bit that is resistant, or that the vaccines are not effective enough at this moment. I mean, the vaccines continue to be a strong vaccine, but we need to have the 95% for the 2 doses, homogeneously. That's like the most important message. Not wait. You have to keep your schedules up to date in every corner of the Americas.
Many thanks. We're getting towards the end, but we just have a couple more questions. One of them is from Dylan Deschong on Haiti. Haiti is currently experiencing a number of challenges with its health sector. How is PAHO helping the government to prevent the spread of measles on the island and also to increase its overall vaccination rate? Dr. Barbosa?
No, thank you for this question. We have a very strong presence in Haiti. We have a big country office there that works together with the Ministry of Health, with civil society in several areas. We also have in Haiti the warehouse where all the vaccines for the countries are stored is in our warehouse that's called PROMIS, the acronym in French, but it's also, I think, that's a very good word to describe it because it's a promising way to keep the Haitians healthy. Working together with the government and with the civil society and other partners, we have important achievements in Haiti. We are keeping the cholera outbreak in Haiti controlled, despite the difficult situation in Haiti. If the cholera outbreak is not controlled there, it can split to other countries in the Caribbean or even Central America and other countries. So it's very important to keep this outbreak controlled, and if it's possible, to completely eliminating the transmission. We are also keeping the only hospital in Port-au-Prince that is open with surgical capacity, with emergency room open, with blood transfusion. The Hospital de la Paix is the hospital that Parro is in charge of, and we are working with other partners like the Inter-American Development Bank to open another hospital in Cap d'Etienne. So yes, we are there. We are keeping the immunization going on in Haiti to protect not only Haiti, but the entire region. Of course, in a situation that is very challenging and very difficult, but Parro is there and working together with the Ministry of Health and Civil Society to, in several areas, including vaccination, and Haiti will also be part of the Vaccination Week of the Americas, with specific actions that will be performed there.
Many thanks, Dr. Barbosa. Tenemos una pregunta de Honduras. Buenos días, de Dania Molina.
We have a question from Honduras, from Daniel Molina. The Secretary of Health in Honduras is investigating the death of 3 children under 1 year of age. These infants died after having received vaccines in 3 different departments of the country. Is Bajo aware of these cases? And what do you recommend to Honduran authorities? And what message would you send to the Honduran population and these parents who now are afraid to take their children to get vaccinated? Yes, Dr. Salas. Yes, of course, we are aware of the situation. Both the country office of Bajo, as well as here at the headquarters, we are supporting everybody. The message, the most important message, is that vaccines continue to be very, very safe. They have prevented 154 million deaths in the world and 15 million deaths. And so we need to continue following a research protocol. And as we said before, we've been given recommendations so that all the research parameters are followed. A prior systemic study has been done. There's a technical study also that doesn't show any irregularities. However, more investigations are going to be carried out to determine whether there is a relationship or not. And this is nothing new. We see that there are cases, oh yeah, they are related to the moment of vaccination, but most of the time they are not a causal relationship. It's more a random thing. The death happens not because of the vaccine. However, it is very, very important that health authorities be transparent at all moments and they maintain open communications. But I insist, vaccines in general are among the safest interventions that we have in the world. In the recent decades, they have saved many lives. I would like to give my condolences to the families of these 3 infants who died. And as has been said, we do have a surveillance system to capture any effect or a side effect that can be attributable to a vaccination. And also, the person may take the vaccine and then they have another disease 1-2 days later. All of this is part of the surveillance system, which is reported by the health ministry, and PAHO provides technical support to follow the protocol that follows a very detailed investigation of the case to have assurance as to what happened. The whole protocol will be followed to transparently report back to the families in Honduras. Thank you. Also to supplement the vaccines purchased by the countries through the revolving funds, all these vaccines comply with the international quality standards. So there is assurance that all vaccines that are purchased that do comply with those requirements and those standards. Thank you very much. Thank you all.
So we're just going to go go to one last question, and we can see that Helen Bramswell has her hand raised again, so I will give her the floor.
Thank you, Ashley. Can you hear me? Yes, okay, great, thank you. I wanted to ask a follow-up related to the Times question about the US president's budget zeroing out funding for PAHO. Has the United States served notice to PAHO that it is withdrawing from PAHO? Thank you.
Thank you for this question, because I think that when I I answer your first question, I take for granted that this problem. No, the US has not informed the PAHO that the country is withdrawing from the organization. The US is a member of our organization, and we value its participation. Of course, that we want more than a formal participation. The US has probably the most strong public health agencies in the world. The US CDC has reference laboratories for the region that are collaborating with PAHO in several investigation of outbreaks in the region, that is providing technical cooperation and support for the countries. The FDA is probably one of the strongest regulatory authority in the region that is part of the network that we have in the region. So it's important to receive the assessed contribution from the United States, to receive voluntary contribution from the United States, but it's more than only the financial support. It's the participation that the US has provided to the organization for several years. So the US is a member of the organization. We value this participation. We are open to have any kind of dialogue, how we can improve the relationship between the US and the Pan American Health Organization. Thank you.
Many thanks, Dr. Barbosa. And I can see that we had a very similar question that came in from the Associated Press as well. So I think that that has already been covered. We've reached the end of the conference. I'm just going to hand over to Dr. Barbosa for some final words before closing. Thank you.
Thank you. Thank you, Ashley. Let me switch to Spanish. Maybe I think that most of our participants are from Latin American countries. De nuevo, yo creo que es muy importante en esta
Again,
semana
I think this week, this vaccination week, it is very important that all countries in the region participate. And I thank the government of Canada for having invited me to go with a team for the launch next Monday. But each one of the countries is adopting initiatives and measures to further vaccination efforts. PAHO supports the countries in this effort. As I mentioned in the beginning, we are the only region in the world that not only recovered coverages, vaccination coverages that we had before the pandemic, but they are now even better. And compared to 2018, 2019, we're better, and we're going beyond that. And this is significant for the region and for the world today. Measles is one of the most contagious diseases known to humankind, and we need to have a coverage of over 95%, and this coverage must be homogeneous. So there is a micro-planning strategy for the countries, because we need to know exactly where non-vaccinated people are located so that we can identify what their barriers are to vaccination. There are some vaccines like the DPT that requires 3 doses. The first dose has very high coverage. The second decreases, and the third one decreases even more. So we need to find information. We need to disseminate information to the families, reminding them and reinforcing the fact that the 3 doses are necessary. You need to vaccinate the 3 times, not only once. So maybe there is lack of information about that. And there is also lack of information about the fact that these diseases are very serious, very severe, that even though they are not widespread today, they can lead to severe cases with hospitalization and even death. So the combination of identifying barriers to better organize vaccination services in the countries, having strategies so that the countries can be innovative and they can have, for example, their health posts open in the evenings and weekends, and also send vaccination teams to markets, to fairs, so that they can check and see that if there are non-vaccinated people there and offer vaccinations. And also, information is important, and in particular, a clear disinformation. Sometimes health professionals believe that people are aware. For example, there is the feeling that people think that the diseases have been eliminated or are almost eliminated, but information needs to continue to be disseminated and education. There is no scientific evidence that supports the kind of information that says, and some people think that vaccines can be hazardous. It's not true. Vaccines are safe. And so there are packages of initiatives to improve access of people to vaccination, as well as training, redistribution of vaccination efforts, and better schedules for the health posts so that people can go get vaccinated and have their children vaccinated during weekends and at night in the evenings. And we need to listen to people. For example, why do they think that people don't need a second dose, or why do they think that they don't need vaccination anymore against polio? So we need to be close to the community, be listening to them. We need to have open doors to receive all the information from people and be able to provide to the families, to the communities, transparent information about the benefits of vaccinations, so that all infants and children in the Americas have the right to have health, good health, and be spared from these diseases. This is the end of today's press conference. Thank you to all the journalists for being here, and our experts from PAHO, as well as Dr. Barbosa. We have received many more questions that we will continue to answer by email. You can continue to send your questions and requests for interviews to the email that you all know. We'll meet next time on another press conference. Thank you.